primary coordinator for the disaster case management. Oh, hang on, I got a little blip saying I have to consent. For the disaster case management program. So right now we are in the midst of the request for information number 4 to make sure that I fine tune everything to make sure that these services are going to be able to be delivered to the counties that have applied for the DCMP that were declared by Hurricane Ida. So the understanding that I have is that the DART program is going to be used by the VOAD during non-declared days, like blue sky days, to manage things that are happening on more of a local level. But when there is some kind of disaster declaration, we're hoping to be able to employ that on a much larger scale, contingent upon the grant awards that are given during a disaster. So I'm anxious for this opportunity to see this tool. I had heard about it we actually have been working on this pre-COVID and started to try to figure out how we're going to be able to learn about it. And then then COVID. I mean, there's nothing else to say but that, then COVID. So I'm happy to be here today, and I'm grateful for the opportunity, and I'm happy to answer any questions that anybody may have about my role. And I'm looking forward to this partnership moving forward. Thanks, Julia. You're muted.
Thank you. Sorry about that. Joanne, anything you wanted to couch this conversation in before we get started and introduce yourself too?
Sure. Good afternoon, everyone. I'm Joanne Haley with Montgomery County Department of Public Safety within the Emergency Management Division. I am the state and federal liaison from EMA around Ida recovery, and we have discussed internally the idea of utilizing DART, the platform prior to DCMP being put into place. We have 4 case managers that are contracting with the county right now at 4 different provider agencies. And again, it's not definite yet, but we've talked about getting them on board with this platform prior to DCMP being put into place, just so they have some familiarity with it. The system we're using right now for tracking case information is ArcGIS, which is obviously not a case management platform at all, but it's what we're using because that's what we started with at the beginning of the incident. So that is our hope.
All right. Thanks, Joanna. And I am really getting ready to turn it over to you, Carol. I think just so you have an awareness of who's on the call, if folks could put just anything, not if you want to add more than name and contact information or affiliation, please do, in terms of either now or as the conversation goes on. If there's something that you have a question about, Carol, I'll let you kind of monitor that. I'll keep an eye on the chat, but let you manage the flow. But if you want to add anything to kind of what you are looking to understand about the tool or what have you, please put that in the chat as well. That being said, Carol, I'll let you take it from here, introduce yourself, and anything else you want to share as far as introduction goes, and then we'll get into it.
Absolutely. All right. Well, good to see you all today. A few familiar faces and a whole bunch of new faces. So that's always fun. Yeah, Julie, if you would watch the chat and if there are questions, feel free to field those to me. I have found I'm not a very good multitasker in this environment. So my name is Carol Flores. I work for VisionLink, and that's been true for almost 6 months now. Prior to that, I was actually a DART system administrator. We used this platform for the Harvey DCMP in Texas. I was the program manager for that. So it was a DCMP that covered 33 Texas counties. We had 14 different organizations that were part of a consortium that we built. And it was a FEMA funded endeavor. And so this platform was built ahead of Harvey, but then we really put it through its paces. And I consider the Harvey work a giant beta test of how this platform worked. There have been a lot of new things that have become available even since we did this work, 4 years ago now. So what I'm going to do is I'm going to kind of walk you through it at a very high level until we get to the actual case management portion of it. And then I'll show you that in a little more detail. I realize you all are probably not going to be the front end case managers themselves. And so there'll be other training that you guys will want to do with your case managers, but I'll show you the platform and how it all fits together. The beauty of the VisionLink tools is that this is one platform with multiple tools available on it. And so Pennsylvania VOAD has already been using some of these tools. And so there's a donations management feature, there's a volunteer management feature. We have the ability to add to this a shelter management feature, a public registration that we could turn on with a link that allows the public to report their damage, for instance. So there's lots of different ways to do this. And the beauty of it is one system and therefore one client record, no matter where you interact with that client for the first time, at what stage of the process. Any point at which you create their record, it is now available to move into different stages of the process. And so there's not multiple client entry. Once a client has a record on the system, it's available across the platform for lots of different ways to access that. So I guess I should share my screen. That would be a good place to start. Let's see if it will let me do it.
Carol, as you're doing that, just want to note there are probably a good number of end users on this call.
Great.
Just so you're aware.
Great. All right, you should be seeing now, hopefully, a blue screen that says Pennsylvania Voluntary Organizations Active in Disaster up in the corner. Good.
Yep.
So this is the DART landing page that is specific to Pennsylvania VOAD. And then as you can see, there's a lot of varieties of things that are available on this page. Of course, the piece we're interested in today is the client facing pieces. And so that's Client Connect. And that's where we're going to go next. My computer is multitasking, so it's going to be a little slow to respond. And so again, we've built this so that there's a lot of different ways to connect with survivors in various stages of their recovery. With the ultimate one being a full form set that is the full disaster case management process. Pennsylvania VOAD has opted to start with, we've repurposed this call center module. And we have created this as a place to gather some early data that is happening via some outreach. And they're capturing this in this call center area. So we've refined the questions a little bit. Pennsylvania VOAD has built a Google sheet that mirrors that. They're calling out to folks, they're gathering that information. And then they've got some volunteers who are coming in and entering data into that call center piece. Julie's aside, Julia, have they actually started doing that data entry yet? I haven't looked.
No, Linda's actually the one doing the callback. She's on here and we haven't put anything in Client Connect yet.
Gotcha. Okay, that's okay, because we have some sample records that we can do. And so as they do that, those will begin to create those client records. And then if you want to be able to now see who all is in the system. So I came back up here and I hit this client search. I've turned my video off to see if we can help maximize the speed here a little bit, and let me move the tools. They're in my way. It is working, but it's crawling. Come on. Minimize this. Sorry, it shouldn't be affecting mine, but we are in the midst of a big old snowstorm where I am, and I don't know if that's impacting my my loading speed. But while this is loading, so where this is going to take us is to the ability to search for clients that are already in the system, and then we'll be able to move them as you all interact with them, we'll be able to move them into the next stages of disaster case management. We're going to try this one more time.
So Carol, this is Liz. Question. So is that kind of, so the call center is kind of like the waiting list?
That's how it's functioning, I think, for you all right now. In fact, Julia, if you want to speak to sort of what you plan to do or what your thinking is around as this data gets into the system, what's going to happen at this first stage?
And Linda and me, and Linda's on this call, so Linda, correct me if my reporting out here doesn't reflect what you understand. But right now, Linda and one other person are making callbacks using a form that mirrors that Client Connect piece that you just saw. And anybody who gets on that form, we're intending to at least do additional callbacks on to delve deeper into for possible case management and moving forward. Some of that will happen. I mean, like we know people like Catherine's team are doing case management with families, especially who are in hotels right now. But we're hoping to expand beyond even Montgomery County to some of the folks in Chester County, and I know York is doing case management already, that then it could be anybody's in that Client Connect kind of as a likely candidate for further case management. If that answers that question.
Okay, this is unusually slow for me, so my apologies, folks. As you guys are talking, I'm going through and shutting down everything else that I can. Wow. All right. It's not your site, it is my internet, because I was in this earlier today and it was loading just fine. So this is much more about me. Julia, while we're waiting on me, would you also try to go in and log in? It might be better if you have a better connection. It might be better if I walk you all through on your site. We can try it from both directions.
Sure, it might take me a minute too.
Sure.
I'll do my best. And it's Stan, I'll ask you too, if you beat me to it.
Let's figure out who gets the best throughput here. I'm going to stop sharing for a minute and see if I can just get it to load faster.
I've got a client at my door. I'll be back in a little bit.
Okay. So while we're waiting, again, my deepest apologies for this. It was fine an hour ago when I tested it. This tool was built just for you all that are particularly planning for a probable DCMP. This was built to be able to manage all of the required reporting that FEMA required of us and that the state required in other DCMPs. So you will notice it's a very, very fully built out form set that captures just about everything. It has the ability to capture referrals and services, to capture the value of those services as clients are connected to them. And so you can do the reporting on that return of effort on the case management, what that value was that case managers were able to connect clients with. It has built into it a Gantt chart, essentially. Yeah, you can't see it right now because I'm waiting for it to load to see if that goes any faster. So I've unshared for a minute to see if I can speed this up any. but the recovery plan process, which is really the heart of disaster case management, that is built into the platform to be able to track that recovery plan, to set those recovery goals along with your clients, and set some timelines around those, and be able to see how you're doing against those proposed timelines. And I will show all of that to you. So, yeah, sorry about that. Julie, are you able to get in?
Not yet.
Gosh. This is just absolutely crawling. Liz, I know you didn't use it in your day-to-day work, but anything else you want to say about DART specifically as it supports? Because I know you all have continued to use it in other case management programs.
Yes, I mean, we've liked it much better than other platforms we've used. We're able to extrapolate management information and reports to use for the state and for FEMA. So it's been very effective for us, Carol. And it's improved since we've started it in Harvey.
Yeah.
I mean, it's gotten better with different modules and different enhancements. And we're able to, just for the group, so when we're doing a disaster case management program, we're able to track the number of client contacts that particular case managers had to make sure that they're doing, their performance. And we also look at open and closed cases. We're able to track referrals and the value of services given for the case managers. We're able to look to see if they took a case to the long-term recovery committee in their community. So it's a very effective management tool. And we pull weekly and monthly reports for states that we're working with. And we're able to show the outcomes for our organization and other organizations that are working the program. So from a high level, 30,000 foot level, it's very effective for management. In Harvey, Carol and I were part of a team that kind of did the 30,000 foot look. We called ourselves the stick people. And we actually were able to go in and do some compliance work too. So if we saw that there was a particular organization that didn't have the same number of contacts, or they didn't seem to be opening cases, or they weren't closing cases over a long period of time, we could go in and monitor that, and we would send them a compliance report, right, Carol, to say, we flagged the following areas. You need to take a look at this because your information is not comparable to what other organizations are at this stage of the program. So it's got a lot of detail on there, a lot of information, but we're always looking at number of cases open, number of cases closed, value of services. What is the tier level? What was the service given based on the tier level? And the key thing, as I said, the value of services. So we want to make sure that the case managers are putting in all that information so that we can measure their great work. And then if we see a group that's not gone to a long-term recovery group in their community, and we know those dollars are there, we try to determine what's going on there. Why aren't they meeting with the unmet needs table?
Yeah. All right, I am trying again. Hang on. All right, I'm going to share again. Something got hung up in it. All right, now you should be seeing, I hope, again, a screen that says Pennsylvania VOAD. And hopefully now we're ready to move forward. Okay.
And Carol, I have mine now too. If you need to come back to me, I'm sorry.
All right, cool. I am so sorry about that. I closed it all out and just did it again, and now it seems to be working fine. So we are now searching for clients that are in the system. As you will notice, you can search on just a whole variety of options. If you're looking for clients that fit a specific category. So for example, we added these questions to that initial call out that you guys are doing around what is their primary source of heat. These are shortcuts. The full questions are actually in the survey. But if you want to search, for example, for people who answered some of these trigger questions, yes, then you could select to search based just where those are yes. You can search by the organization that's managing that client. So again, a whole bunch, and these are just search parameters. We haven't started putting a lot of data into the system yet. So I left all of those parameters blank and hit search. And so I got this return. These are some practice accounts that we have put in. So these are now our clients that are in the system. And what I want to show you is how we now can access these different form sets for each of these clients. So when you click into a record, oh, don't do this to me again. It got so far and now it's going to start crawling again. There we go. So it'll take you to the information that was gathered in that first outreach. So as you guys start putting that data in and those client records populate, when you click into the record, that's the first place you'll go. And it'll take you to the form where those outreach questions were answered as your reference place and as your starting place. And let's say that you are ready to now move this client on into intake. We click on the intake button up here in the corner, and it takes us now to the next layer of questions. It's a little more detailed, particularly around the impacts to the household, some vulnerabilities. We can begin to now capture some case notes about our interactions with this client. And this is where we begin to screen those clients for further case management. And capture some more information. We can assign them to an organization. Any of you all, as your organizations get registered in the system, you'll be available to have clients assigned to you. We can begin to, see we've loaded up a consent to share document. So you can begin to have a more personalized interaction with the survivors at this point. When you're ready to begin the case management record, from here, we can also capture now the information around other members of that household. Should open that up for you real quick. This is pretty basic, but it's collecting information around, again, other members of the household with the understanding that the record will be attached to that primary client that you have interacted with. But if you want to be sure to capture names of other folks in the household, you'll have the ability to do that. Let me go back. Come on, you were doing good. So this is now that next layer of intake. And once you're ready to move this client into full case management, you can open up the case management forms. All the information that you have already collected will move with that record. And now here is the full-blown disaster case management and all of the pieces that go with that. So again, any information that you've already collected has moved into this record, and it begins populating the case management record. And now, of course, there's tons more information that you can gather and that you can capture here. We have the ability to easily change what fields are required or unrequired. So as you flesh out your case management program, if you want to be sure that a client record cannot be saved without these 5 pieces of information, we can configure that for you. You'll see that we've got some already pre-configured, but we can change that as you all, again, begin to flesh out your program and figure out which pieces are the most necessary and which pieces you want to be sure that case managers capture. So this is, again, more detailed intake. And then we move into some of the assessment piece. You have the ability to capture both pre and post disaster information around housing, address verification. Again, more information about level of damage for homes, what the living situation was, all those kinds of things are available here. We have a quick capture of some income and expenses assessment level. Here's the recovery planning piece that I was talking about. So we, for our FEMA reporting, needed to be able to say how many recovery plans were created. And so we did that by counting these date entries for our program, for example. But you will be able to create goals, recovery goals for your client. You can tie those to this list of recovery needs that's in the system. We can track the status of how you're doing against that goal. And let me create one here real quick just to show you how it works. Yeah, if somebody wanted to jump in with a question, I thought I heard some. We need to have the house repaired by, let's say, July. And this is part of their permanent housing. And right now, we don't have a goal on that. And if I save it, you'll see now we've started this recovery timeline. And as I add, and now I have the ability to add another goal. And as I add more goals, all of those will stack up on this timeline. We can come back in and edit that first goal. We've abandoned it because never mind, we're moving, so we don't need to repair the house anymore, all those kinds of things. And now you get a recovery plan, and this list can be as long as you need it to be for each client. It can be as granular or as broad as makes sense for each case manager and each client relationship, right? These goals, it could be, I could have had 5 goals. One was repair the kitchen, one was repair the bathroom, one was, right, repair the roof. So it's really meant to be as helpful or as customizable as necessary to really help that case manager and that client conversation around recovery. And then these are all reportable fields. So the status of these goals, you can report out on, which we found really helpful in our case management program, to be able to say that while we may not have been able to report that the full recovery plan was met, we were able to report that, 75% of all goals were met, right? So even if you can't fully meet all the details of a recovery plan, you can talk about, there's a lot of room between a recovery plan that was not completed and a recovery plan that was completed, and we were able to report on that space in between. We also have the ability to tag referrals directly to a client, and these will pull from a resource database that you all will be able to populate specifically with resources particular to your recovery and your disaster. And as that resource database is populated, you can now tag referrals to those resources to each client in the system. And then you'll see, as those happen, you'll see a history of those referrals. You can come back and report that those, not only were they referred, but a service was actually delivered and the value of that service. That happens once you've picked a referral, but all those fields exist to be able to report that that referral was successful. Liz was talking with unmet needs tables and long-term recovery groups, and other resources that come online, as we know, after a federal declaration. So you have one place to capture all of that information. And then there's this tab at the end that's just sort of your big picture view of what's going on with this case. So you can set the case status. You can, if it makes sense in your program to monitor sort of how the case is progressing, you have the ability to do that. We labeled ours, and so this is left over from how we did ours, as priority levels. For other folks now, we have renamed that to be tiers to more closely match with FEMA's language. You can track your case managers that are assigned to this case. You can assign case management supervisors. You can note, obviously, level of contact. You can track when your follow-up dates are. We have the ability, but we haven't standardized it yet, is to have this be a search that will now trigger the tasks, or at least be a task reminder that you have follow-up dates that are coming up. I think we can go back through and make that available to you. And then this will have, this is where your case notes will be captured, and you'll get a running log, I believe. If not, I'll set it up so that history shows. In fact, I think I need to do that. And then you have, again, if you want specific dates captured around the FEMA funded DCMP specifically, then there's just another array of date fields that you can capture. All of these are up for your interpretation as a program to decide, right, how you want to best use it to meet your program goals. One other piece that's in here that I think will be really important for you all in Pennsylvania is this ability to, every case can be marked, and in fact, in this case, it's required, as part of either your FEMA-funded DCMP, or it's case management that's happening in Pennsylvania, but it's happening outside the FEMA-funded DCMP. And so you can tag those cases and separate them. So when it comes time to report, if you're reporting to FEMA, you can filter out and only report those FEMA-funded cases, or you can only report only on those cases that are happening outside the FEMA funding, or at a very high level, you could report on both, right? You could see the whole big picture, but then we can filter those cases apart so that if the Lutherans, for example, are doing part of their program is happening in those counties that have the DCMP, and then they're also doing case management in those counties that are falling outside the FEMA funding, one platform, one setup, but they can separate those cases out and be able to report cleanly depending on the grant source. That was a super quick walkthrough. And at this point, Julia, tell me what else you think would be helpful at this stage, and or do we want to answer some questions?
I'd say go to questions.
Is there questions? Oh, I'm looking at the controls.
Are we able to upload data on the back end for cases that we already have opened?
So we can make that happen, absolutely. It's just a matter of doing some of the mapping and figuring out which fields you want to go ahead and get uploaded, and right, which information you want to move over into the system. But yes, that will require some VisionLink intervention. But yes, we can support that. Absolutely.
What about uploading data that isn't currently attached to a case worker or any kind of case management? Like I'm thinking of lists we have from various places. Would that, if it's not attached to a case manager, how would that kind of display in the database, and how would you kind of then re-access it once it's in the system? Like if we did a data dump of crisis cleanup information or Red Cross data, how would we
Right.
go back and see which cases like have been touched or not touched? Or
We would need to think through the workflow for how you wanted to do that, but I would propose something along the lines of similar to that call center form that you're using, right? That's not attached to any one organization or any one case manager. It's just the basic beginning of a client record, and then you can search. And when you're ready to call back to that client and see if they want to move into case management, then you can basically start from that client record and move them through the next steps. So we could create a workflow for that, but to have those lists dumped in means creating at least the beginning of a client record similar to what you're doing on that call center piece. And we've done that in Colorado, for example. We just finished taking the crisis cleanup data, mapping it, and creating a baseline of client records that you can find on a search, call back to those folks and say, are you interested in case management? And if so, then you begin to walk them in, just like we looked at just now, and move them into case management and start assigning an agency and assigning a case manager.
other questions?
Julia, this is Glenn. I have a
Yes.
question. I'm just interested perhaps in the workflow or how this will flow. It sounds like there's going to be an intake opportunity. Information will be uploaded somewhere using that form that you just kind of addressed. So is there going to be someone who's doing that for all of IDA and PA, or is that going to be county specific? And if that's the case, it might be helpful to go through using this platform from the start, just like entering a new person, putting in pertinent information, kind of how then that would go from case management into, an unmet needs committee, that sort of thing. That I'm making sense.
Yeah, and Luke, can you help me with this too? Right now, it's up to us really how that workflow looks collectively as Pennsylvania VOHEAD. I'm personally envisioning it how you said, like it goes in through someone, a number of people have the ability or will be able to have the ability to add a initial intake into that client connect. But then I see it as being able to say, okay, there's, a couple people designated for York County, then have access, like 2 or 3 case managers who then can access the York Avenue is our local elementary school here, the York County data, and then they take it from there. And maybe I guess one of the things I was going to ask was, Carol, could you like take us to that long-term recovery fields again, and how you would sort, let's say there was, a number of cases entered by, whether it was data dump or whatever, that we could filter it by count, like long-term recovery committee or something, so Stan and Glenn and whoever could see the York County cases.
So I will tell you that at least right now, the way it's set up is it's more as a reference point for the case manager than it is as a management tool for the long-term recovery group.
Okay.
If that makes sense. But we definitely could use these existing fields here combined with the county that the client's address is in, right, to begin to pull some data for long-term recovery groups. Absolutely. We can build that ability to report out for you. These are attached like I said, to individual client records, and it's meant more as a tracking for the case manager and the client. But we absolutely could pull this data and shoot it over to a long-term recovery coordinator, or whatever that needs to look like.
Carol, question for you. Are we charged any development hours or hours for your time at all? Or do we have a certain bank of hours?
There's a bank of hours that was part of the contract. Julia, you can probably speak to that better, but there was a bank of hours as part of PA's contract with National VOAD. As you all move into particularly FEMA funded things, it might make sense to revisit that if you're going to want some more customized kinds of pieces and some different configuration. And then, yeah, you could work directly with VisionLink for that. Right now, we're working off of a bank of hours, and we're well within those limits.
Okay.
And I don't have exact numbers in front of me or the contract in front of me. I thought it was actually spelled out in general terms right now, but I can look back on that, Luke, and find more, which it does go to Denise's question in the chat too. And then I want to come back and make sure we answered Glenn's question. But Denise asked what kind of support is offered, and when there are questions or issues that users have, who do they go to?
So I would suggest that you all determine that as the lead agency, Pennsylvania VOAD. There is a VisionLink help desk. When I was doing my program, I found that it wasn't helpful to have my very front end users going directly to the VisionLink help desk. I wanted a layer, because often their questions are more programmatic than they are mechanics. And so I think you all will want to establish a help process of some sort. But there is a VisionLink help desk. The general rule of thumb was, if something was working and it now is not working, help desk is a good place to go for that. But depending on how big your program gets, I think you'll want your own intermediate step in there.
Julia,
Yes.
the way that's worked for all the previous modules is I was the PA VOAD point person. So any questions came to me. If I wasn't able to answer them, I would go to April at NVOAD, and she would try to help. And then the final resort was that she would pose the question to the folks at VisionLink and then supply the answer.
Yeah.
Thanks, Dan.
Yeah, and I'm just saying, when there's a DCMP and we've used DART, then we have data compliance people that do that for the providers. So there's a trainer, and there's usually a data compliance person associated with each organization that then goes to the lead organization's data compliance. So there's training throughout the program on that, and support for the DCMs.
Glenn, did you want to follow up on the question that you had as far as entering the case information? I'm not sure if I answered that adequately or not.
I think as confused as I was before. So I'm just not quite sure that I understand. I guess what I'm trying to understand is how this is going to work. Okay. I have at least 2 case managers on the call here who I think are hoping that after they're done with this, they'll be able to do the work that we need them to do in York County. And I guess I see Linda has her hand up. Maybe she's going to try to offer some insight. But what I'm saying is, when folks identify themselves as having unmet need, they're going to call a certain number or email whatever that contact form is that's still being developed. And then someone's going to enter their information in this system. And then once the information is in this system, the local case managers will start making outreach contact and somehow get information to an unmet needs committee. Am I making sense so far? Does that sound like that's an accurate depiction of what's going on?
It does, I think, and Linda, hang on, I got your hand up there. It does to some degree. I mean, there's a number of ways I think things could get in here, but the first thing is whatever agency is going to use it has to be cleared or, sign the agency user agreement to even get on here, which is still a document that's being created by Pennsylvania BOED. And honestly, like, I'm the point of failure on that. I just can't keep up, but I'm working on it. So we're working on creating, what is that agency agreement, getting that signed by whoever agency that case work manager is associated with. So let's say they're associated with the Salvation Army in York County. Salvation Army signs that user agreement. Case manager, whoever's representing the Salvation Army, gets connected with, gets their logon privileges or whatever, and then that person can start entering data from, whether it's from that outreach form or some other method, into that Client Connect, and then take it from there. So there's a couple ways, data could get into that Client Connect thing. One would be like that data dump kind of that we were talking about, but I do think the most logical way is through that Client Connect portal. Like if you would do that outreach, and really each individual community is going to have to do their own outreach. They can use the tool that we've created that mirrors that Client Connect piece. So you could have any number of volunteers making those initial callbacks to kind of get information. But then when that information, you have that information, it's going to have to get into Client Connect. So that's where, those eight, whoever is that registered agency user is going to have to put that into Client Connect from there. And then be
So I saw a question around capturing case notes, and the answer is yes. And I have a note for myself to go make sure that this field is the same one that carries over into the other forms, so that you have a running log of what interactions have happened with those clients so far. And you'll notice that the field itself captures the date that the note was created and who created that case note. So today I made a note that we tried to call this person, and you'll see that it's noted as I was the one who did that because I'm the logged in user here. And it looks like there's some connectivity pieces because we've fussed with this a little bit. So like I said, I have a note to myself to go make sure that this works all the way through.
Linda, you had your hand up too. I just want to make sure I didn't.
Yes, I'm actually trying to see the bigger picture of it. Am I understanding that multiple counties will be in here? Is that correct?
Correct.
Then is there a way to sort that you can look at one county?
Yes.
Suppose I say, well, I can do case management for, I'll use Bucks. So is there going to be a way that I can go in there and see who's been entered in there? I won't have names. I just need to go by county. So how would I do that?
So I am on the search screen, and you can enter, if you're in York County, you can say, search for all of the client records that have York County as their address. And county is one of the fields that populates when we capture addresses. And I don't know that we have any records in there yet, but I could search for that. And sure enough, right now there's no one, right? But you can use a search to, Julia, what county would you have put in your test records, do you think?
Montgomery, maybe, I don't know.
Let's see, let's try it. So now we're going to see, and can we search for any records that exist in York or Montgomery County? Nope. And if I, hang on, if I clear that and say nothing, just so we know there are records in the system, right? So it's filtering based on your requesting to only show me things in a specific county. So yes, you can narrow your search down for who already exists, even if you don't know names.
So where am I going to make this request? Is that top line or what?
When you're in the system, you're doing this. So this is the landing page.
Right.
This is Client Connect in this corner. And you're searching for clients right here at the very top.
Okay.
And what that takes you to this search screen. And now you can start to search by any one of a number of these things. The more parameters you put in, the narrower your search results will be. And this is searching those call center records that will be entered into the system. That's what this is looking at, and finding any of those beginning data sets that are being entered as those call outs are happening. So right now, there's no live data in the system to search. There's only those handful of test records that we've put in, or that you all have put in. Does that make sense?
Well, could you use Julia's Montgomery County? Like, could you do that? Just where would you type in you want to search for Montgomery County?
So I'm down here. One of the search elements is, we need to see if this is the address that we capture, but one of the search elements is what's their address. And you can, I don't know if you can see, it's probably small, but right here,
right, one
of the elements is county, and you can say that it exactly equals or it contains or whatever, right? But you pick how you want it to filter. And in this case, I want it to look for records where Montgomery is the county that's in the record. And I think we're going to find, did I not spell that right? Montgomery.
Carol, go look at all the records, pick one and find out what county it's in.
So yeah, and that's how we look at all the records, by the way, is just leave everything blank. Hit search. I suspect we may not be requesting, oh, it is. Okay. I need to update this. We have two different types of addresses in the system. We have where you were before the disaster and where you are after the disaster, because they may not be the same thing. So the search is looking for your post-disaster. You all are capturing pre-disaster. I have a note to get that corrected for you, but she put Montgomery County here. If I had the search set up differently to be looking at pre-disaster address, it would have pulled this record as someone in Montgomery County. And then when I clicked on her record, so let's assume that that piece worked right, and I'll make a note to align that with pre-disaster, because those are the addresses you're collecting right now.
So we'll get that with that corrected, but the intent is the same, that you can filter by county and look at things.
Right. And then it'll pull up a list of records that match those criteria, in this case, county. You click on that and it'll take you to, you click anywhere on that. It doesn't matter which one you pick on, but it will take you to now this data that was sort of that initial call out, the information that they captured on that. And this becomes your starting place. You have the ability to review this. And if you, in this case, so it's filling in some of that basic information. You're adding case notes. If you call that person and they want to do the next step with you, you click on this intake, and it takes you now to an even more detailed form where you can capture new information as you talk with this client. If you're going to do other work at this stage and we need to capture different information, let us know and we can help make that happen. This is not the full case management form set, but you can get to it from here.
So want to go to there was a couple comments related to that that I want to pick out. Alan put in there as far as a sequence of case manager interactions, and essentially that's what I think you're talking about here, and where that goes into the further case management, that next step. Correct?
Mm-hmm.
So this is, Alan, you want anything else you want, and I can address your other question about Chester County there too in a second, but do you want to follow up on that, Alan, at all? The other question that Alan had was he's going to be working in Chester County who does not have access to the DART tool. That's not true, Alan. I just want to clarify. I didn't mean to sound snarky. I just mean while Chester County did not apply for the federal DCMP, if an agency such as UMCOR or another agency wants to be a part of DART, we have to come up with what the criteria are for the agency users, but as long as an agency is willing to pay the $40 per month per user fee and sign the user agreement, that agency can participate in this. So I just don't want you to think that participating agencies can't participate just because the counties didn't opt into the DCMP. That's partly why we have those records. We have that one field where it's a FEMA program or non-FEMA program. So just want to be clear that there's workarounds for that. And I also saw Denise's question. Can you speak to that, Carol, a little bit? Denise's question is, do we have access to our how closed is this access? Like, could we limit it if there was a case manager who's just working in York County, that they only see York County data, or just, if you're the case manager assigned to a specific person, are you the only one who can make changes to that? Or can you just talk about kind of the boundaries of access?
Sure. So a lot of that will be managed at each person's account. And this is where Stan will be your best friend until he says no more. But yes, you can. Right now, the way we structured it, at least for Harvey, and if the request is different, we'll have to go back to the drawing board. But editing is limited to agency. And so if the record belongs to Catholic Charities, any Catholic Charities people who have editing rights can edit any case of Catholic Charities cases, but they can't edit Lutheran Social Services cases, right? And so it's not restricted by person as much as it is restricted by agency. So if you have editing rights, you will be able to edit within your group. We can build, again, the filters such that if you want case managers to only be able to get to the cases that they're managing, I think we can build those filters to do it that way. Definitely. In fact, I think there is a way we did it before where it's sort of a default. When you go to search records, we can build it such that one of the default criteria is that it only returns cases with a certain case manager assigned. And so you would have to override that if you needed a broader search return. So the answer is yes, we can configure it in a lot of different ways. The more granular you want it and the more controlled you want it, the more time it's going to take us to get it configured exactly that way. But yes, most of that can be done.
So I just have a follow-up to that question, a follow-up to my question. We were talking originally about the possibility of putting in these unassigned cases. So they would then be available for anyone to access until we assigned them until a case manager took those, or an organization took those and had them assigned to them.
Yeah, you all would have to help us, as one of my colleagues likes to say, figure out where to set that dial, right? Do you want those unassigned cases to just be one big pool that everybody can get to? Do you want there to be a group of users who direct those cases and assign them out by some process, whatever that is? We can support that, whatever workflow makes sense for you guys.
And what's the turnaround time for this to be, we're talking about making all these tweaks to it to make it specific to our group's needs. What kind of turnaround time for access are we looking at?
I think particularly around the DCMP, now would be the time to start thinking about what you want those walls to look like and what you want those access configurations to look like, so that we can have time. Some of the more granular you want it to get, the longer it will take. Some of these are as simple as, a couple of days to refine the request and make it happen. The more specific and the more granular, we could now be looking at, a couple weeks to make sure we fully understand what needs to happen and to test it and make sure it's working the way you want it to work.
But I would suggest that agencies who want access let Julia know that you're interested in filling out that agreement once it's ready, so that we can start authorizing users into the system even while Carol and the folks at VisionLink are finishing the tweaks. So you should be thinking, because we only have 8 seats. So we're talking about, because I'm one and Julia's one, we have 8 available spots for people. So
Wait, can we just go back to that? So that's still a point of confusion for me too. I mean, if you're paying the $40 per month per user, isn't there more than that 8 slots available for case management?
no, not as far as I know. We would have to go back to April at NBOAD, because even though we're paying for that slot, it's still part of a larger picture between VisionLink and NBOAD.
I would recheck that with April. I think there may be some nuance there. I can't speak for what the agreement is, but I would encourage you guys to double check that.
I will do that.
Yeah.
Stan, your thought is that there's 8 counties that are involved and there's 8 individuals who'd be able to access this platform.
Well, let's say, for example, that one case manager handles 2 counties. So that would be that one seat would be covering 2 counties. But if 8 counties want to have a case manager, yeah, then if one more came along, we'd have to go to April. And she said that we have to let her know what our needs are, that they could shift seats from states that aren't necessarily using them. So at Carol's provocation, I will go back and just verify that that's how this works. But that was my understanding.
And just another point there, even want to note that we don't even anticipate all 8 counties doing case management. So I do want to revisit that with April. But in any case, Stan's point as far as, yes, please let me know if you're interested. And I think in my mind, the next steps too is I don't want to be the one the sole person making decisions on behalf of Pennsylvania VOAD as far as who's in and who's out. So as far as a number of your agencies are PA VOAD members. And Luke, I'm turning to you again on this because you're part of PA VOAD board, and Stan as well. I think it makes sense to get a group of us to be at least an ad hoc kind of group to be reviewing, okay, we have a template for the user agreement from National VOAD. I've already started working on it. It doesn't have to have a whole lot of tweaks, but just want to get that situated so we can decide on something and we can get it out to agencies who wish to participate.
Yeah,
So we can start getting people on board. Go ahead, sorry, Luke.
I was
That
just saying,
makes sense?
totally makes sense. Yeah.
Okay.
Julia, and you all as the VOAD board, once you get a sense of who does want to be here, I think it makes sense to set up some time for us to kind of get down into the weeds and figure out how best to configure it for access so that it works the way that you need it to support the reality where you are. A caveat to that is that it is a global system for all participating agencies. So whatever we set up by way of just sort of general access guidelines, that's going to be true for every agency. So it's not like each agency has its own space that can function significantly differently from how another agency's space is configured. It is a shared database. And we can create some walls so that you're only seeing the pieces that you need to see, but those walls all have to look the same for everyone. Does that make sense?
Yes, it does. Other questions for Carol or the group? I have one around kind of the boundaries again too, Carol. Just over the years, even thinking back to the days of CAN, the Red Cross system for data management, was the question around government partner access. Talk a lot about, that there is the possibility of access of seeing like aggregate data, but not individual level. But also wondering, what have you seen in that regard? Have you seen some places where it makes sense to allow partners like Joanna from the county or our PEMA Vals to see things, or do you generally see it as a best practice to limit that? Can you just speak to that a little bit?
Sure. We've seen it done a bunch of different ways because at the end of the day, VisionLink is simply the tech, right? We don't set the rules around who has access to the tech. That said, I would say that still the best practice, particularly in the VOAD world, is that there is a very hard separation between government and voluntary access where clients are concerned. So where there is client data, which this obviously would be, I think you will find that it is an easier conversation with your clients when you can definitively say, this is a private database that the government does not have access to. I mean, that's for you all as voluntary sector to be able to have that conversation with your clients as you're asking for permission to enter their information into a shared database. And again, I don't know exactly the wording of the language with your contact with National VOAD. I would suspect that that's part of your requirement in using a National VOAD affiliated system, because that's a pretty hard line in the National VOAD world. But yes, and we did for our project, we shared all kinds of aggregate data with FEMA that did not require their ability to log on to the platform. We would pull aggregate data from the platform and share it with FEMA in lots of other ways, but we were able to do that without them having direct login access to the platform. Now, the other thing to think about is when you get into a FEMA funded DCMP, your funder, the state of Pennsylvania and or FEMA, has the right to do client file reviews. And so we're tackling these questions with other people as well as the world moves away from paper files. How will you manage file audits? And it's doable, but it's something to think about. If there's not a requirement that there be parallel paper files. If there's paper files, that allows you to keep even program auditors out of the system.
Gonna go just to some folks who have experience with these kinds of things, Liz and Brian and anybody else who would like to chime in. Is there anything that you seems obvious, or that we're missing that you think should be stated or want to comment on?
Well, Julia, I was just going to say, and Carol knows this, when it goes into a DCMP program, there'll be some very different parameters on the system because of PII and what we have to protect on FEMA data.
So Liz, I mean, those are the kinds of things we should be, in my mind, thinking about now while we're setting this up. Is that correct? Or can that be changed later?
That can be changed because right now you're just putting survivors into that call center and then assign them. When we get into the DCMP, there'll be a different section, right? Will be labeled, and only DCMP organizations will have access to that.
Well, that's not my understanding.
No, it's Liz. It's the same form set because case management is case management regardless of who's funding it. But we will set up the agency access and the client record filters such that only users affiliated with the DCMP will be able to see the DCMP associated records. That'll be done through filters and those kinds of things. But the data forms where we collect the data, those are the same.
Right. But I'm talking about the actual client information.
Right.
Yeah, because FEMA's gotten really rigid about that with PII.
Right.
Don't we know it?
And that's where that program designation will come in that if it is a FEMA funded case, that's an indicator that this is a DCMP case versus just a generic DCM case. And users who are, so for program planning, however, that does point to, you'll want to think about your staffing. If you want to keep those lines really clear, you'll want to have staff who are dedicated to the FEMA funded program, potentially be separate from the staff who are working other case management clients. Again, to just keep those boundaries really, really clear. And that may be easily done because you guys are organizing that by counties. So it may not be as challenging.
And so every case entered right now, just even if someone gets FEMA funding, if they get a FEMA award for individual assistance, that is not what we're talking about as a FEMA funded case. Every case going in right now is not a FEMA funded case.
Right. Yeah, think about that as who's funding the program that's providing the case management. That's what that program designation is about. And right now there is no FEMA funding for case management. So right now everyone is non-FEMA funded.
I'm just confirming. But that's easy to change, right? If we do like a bulk load of clients that we're already providing case management for into the system, it's non-FEMA funded right now. When DCMP goes into effect, it is now funded by FEMA. We just can change that. Okay, toggle it.
Yep. Just toggle it over. Yep. You may want to capture then at the same time, I'm just thinking about reporting. You may want to capture a case note that says, hey, this person was moved into the FEMA funded program as of July 1st, right? Just for your own records, because the field won't capture that history of the change. But it'll now move that client into that bucket and separate them out from the non-DCMP counties.
Any other questions, comments? So our next step as Pennsylvania VOAD is to get a group of us that are on this call together to look at that, just finalizing what pieces we need in place and start onboarding agencies. Just to be clear, and we're working as quickly as we can on these things. Not hearing or seeing any other questions in the chat. Want to thank you, Carol, very much for the time you took today to spend with us. Thanks for your patience with the technology too.
Thank you all for your patience. That was frustrating for me too, so thank you.
All right. So with that, I'm going to stop the recording and I'm going to turn it into a YouTube video, and it'll be available if we want to look over this again. And I will be back in touch soon. And thank you, everybody, for joining today.